Joining me now is Dr. Kyeremanteng, Department Head of Critical Care at the Ottawa Hospital. Doctor, good morning. It's been a long time. Great to see you. But unfortunately, yet again, we're talking about something that is impacting a lot of people. We're seeing a record number of infections of this type of strep. First of all, can you tell us what this particular strain of strep is all about and how it presents?
Yeah, it's a great question, Marcia. So this is Group A strep, and you'll hear different names when you Google it or search it. But the most common or feared one is as flesh-eating disease or necrotizing fasciitis, and it has variations in terms of how it could present. Sometimes it could present with a sore throat or an ear infection, or a skin infection, and this is where we're seeing a lot of, unfortunately, in the intensive care unit. And the concern is that it can be rapidly progressive and life-threatening. And
Life-threatening. Wow.
Yeah, this is unfortunately why I was keen on being able to speak to you today about it, because we've seen more cases of this in our intensive care unit, and the results have been pretty significant, where people have lost their limbs, people have passed away, and one of the main messages that I'm hoping to come across, Marcia, is that if you are having signs and symptoms, not to ignore them and to seek medical attention as soon as you can.
Okay, so we said in the lead up that this strep is infecting a lot of people under the age of 15. Can you speak to that, and why might that be?
Yeah, it's a good question. I mean, this is not in my ICU. We don't see the pediatric population, but certainly in winter months, we know that any upper respiratory infection can be increased risk of being transmitted, and so this is one of the factors. But certainly, when it comes to the adults, we're seeing a higher risk with our diabetic patients that are obese. And so recognizing those signs and symptoms, and once again, it could be sore throat, it could be ear infection, it could be a rash that is rapidly progressing, and you have systemic features as well, like fevers, chills, and just generally feeling unwell. So this is important to articulate to your healthcare provider, and if it's aggressive, you need to seek medical attention.
How infectious is this strain of strep?
Yeah, it can be quite contagious, and most of us, like, it's always been around. Most of us have the immune system to be able to mitigate it and not make it an overwhelming infection. But for some reason, we're seeing more cases of this, and it's not clear. I guess there's no signs that the virus has changed, and there's no clear signs that our immune systems have changed in response, but there's something about it these days that we're seeing increasing cases. So once again, if we're seeing clear signs that this is present, I really encourage those to seek medical attention.
Once it's diagnosed, what's the treatment?
Yeah, good question. So this is when time is of the essence. So the sooner you could be seen and treated, the better. So antibiotics is the key. So usually one of the penicillin relatives, and then there could be more aggressive treatment if you're landing in the intensive care unit. Extra antibiotics. There's some immunoglobulins that we could prescribe. But the key is to have early antibiotics provided and monitoring. And that's the other thing, because if for example, if it's on a lower limb and it's rapidly progressive, you would need to go to the operating room to have it assessed and trying to control that infection.
Doctor, this sounds pretty scary. What can we do? What can everybody do that is watching us have this conversation to protect themselves? Is there a vaccine? Does the flu shot help you? What can one do?
Yeah, that's a great question. I honestly, there's not much in terms of protection, but once again, for me, it's always be the healthiest form of yourself as you can. Exercise, eat well, reduce your stress, and because once again, we do see there are some risk factors associated with those that are less healthy that seem to be becoming sick and landing in ICU as a result. But The key thing is, control what you can control, stay healthy, but if you are having signs and symptoms, to seek medical attention.
Dr. Kyeremanteng, he is the department head of critical care at the Ottawa Hospital. Thank you so much for joining us.